Breast cancer, a hidden disease, strikes silently in millions of women. Are you ignoring the warning signs of breast cancer? Breast cancer, a hidden disease, strikes silently in millions of women. Are you ignoring the warning signs of breast cancer? Welcome to WA Health and Care. Today, we're discussing breast cancer, a condition affecting millions in the UK and USA. According to leading specialists like Dr. Sarah Mitchell, early detection is crucial. Stay with us to learn what it is, its causes, symptoms, prevention, and treatment options. What is breast cancer? Breast cancer is one of the most commonly diagnosed cancers among women worldwide, and it occurs when the cells in the breast begin to grow and divide in an uncontrolled way. According to oncology specialists and major cancer organizations in the UK and USA, such as the NHS and the American Cancer Society, breast cancer usually starts in the milk ducts or the lobules, the glands that produce milk. Over time, these abnormal cells can form a lump or tumor, and in some cases, they may spread to nearby lymph nodes or other organs if not detected early. In most cases, breast cancer develops due to changes in the DNA of breast cells. These changes can be linked to aging, hormonal imbalance, family history, lifestyle factors, or, in some situations, no clear cause at all. Specialists highlight that early detection is the key to survival, because when breast cancer is diagnosed at an early stage, treatment options are often more effective and recovery rates are significantly higher. Breast cancer does not only affect older women. While the risk increases with age, doctors in both the UK and USA confirm that younger women, and in rare cases, even men, can also develop this disease. That's why awareness, regular screening, and understanding warning signs are so important for every age group. Common early symptoms can include a lump in the breast, changes in breast shape, skin dimpling, nipple discharge, or swelling around the breast or underarm area. Oncology experts advise that any change that feels unusual should be checked by a healthcare professional, even if it seems small. Medical professionals strongly recommend routine mammograms for women starting at age 40 to 50 depending on regional guidelines. These scans help detect changes that cannot be seen or felt, giving people a better chance of catching breast cancer early. In simple terms, breast cancer is a condition that requires awareness, timely medical attention, and routine screening. With the right information and quick action, early detection can save lives. What are the causes of breast cancer? According to oncology specialists across the UK and USA, breast cancer develops when certain breast cells experience genetic changes that cause them to grow and multiply uncontrollably. While there is no single, definite cause, research shows that a combination of biological, genetic, hormonal, and lifestyle factors can increase the risk. One of the strongest known factors is age. The risk of breast cancer rises as women get older, especially after the age of 50, because cells naturally accumulate more genetic changes over time. Family history also plays a key role. If a close relative, such as a mother, sister, or daughter, has had breast cancer, the chances may be higher. This is often linked to inherited gene mutations like BRCA1 and BRCA2, which are widely studied in both UK and US medical communities. Hormonal influences also contribute significantly. Long-term exposure to estrogen, whether due to early menstruation, late menopause, or certain hormone therapies, may increase risk. Estrogen can stimulate breast cells to divide more frequently, which raises the chances of abnormal growth. Lifestyle factors are also important. Specialists emphasize that excessive alcohol consumption, smoking, a lack of physical activity, and obesity, particularly after menopause, can all contribute to a higher risk. In these conditions, the body may produce more estrogen or create inflammatory changes that support cancer growth. Environmental exposure, such as radiation to the chest during childhood or teenage years, is another recognized cause. Similarly, dense breast tissue, common in many women, can increase both the risk and the difficulty of detecting early changes. In some cases, breast cancer occurs without any clear reason. Doctors from major health institutions in the UK and USA highlight that many women develop breast cancer even without having traditional risk factors, which is why screening and awareness are essential. Overall, breast cancer results from a combination of factors rather than one single cause, making regular monitoring and informed lifestyle choices extremely important. What are the symptoms of breast cancer? According to breast health specialists across the UK and USA, the symptoms of breast cancer can vary widely from person to person. Some women develop clear early signs, while others may notice very subtle changes. This is why experts, including Dr. Emily Carter, a leading consultant breast oncologist in London, stress the importance of knowing what is normal for your body and recognizing even the smallest change. One of the most common symptoms is the presence of a lump or thickened area in the breast or underarm. Not all lumps are cancerous, but any new lump should be checked by a healthcare professional. Many women describe these lumps as firm, painless, or different from the surrounding tissue. Changes in breast size or shape can also signal an underlying issue. If one breast suddenly appears larger, swollen, or visibly different from the other, it should not be ignored. Specialists warn that even gradual changes can be significant. Another key symptom is skin alteration. This may appear as dimpling, puckering, redness, or a texture similar to orange peel, known medically as peau d'orange. These skin changes often indicate inflammation or deeper structural changes within the breast. Nipple changes are another important sign. This can include inversion, turning inward, sudden sensitivity, itching, crusting, or discharge, especially if the discharge is bloody. Experts from the American Cancer Society emphasize that nipple changes should always be professionally assessed. Pain in the breast is not always a sign of cancer, but persistent, unexplained pain should be taken seriously, especially if it occurs in one breast only. Some women may experience swelling under the arm or around the collarbone, which can indicate that the lymph nodes are reacting. Because many early breast cancers cause very mild or no symptoms, regular self-examinations and routine screenings remain essential for early detection. What are preventions and precautions for breast cancer? While breast cancer cannot be completely prevented, specialists across the UK and USA agree that several lifestyle changes and precautionary steps can significantly reduce the risk. According to Dr. Sarah Mitchell, a senior breast health consultant at the Mayo Clinic in the US, prevention starts with understanding your body and making consistent, protective choices. One of the most effective steps is maintaining a healthy weight, especially after menopause. Excess body fat increases estrogen levels, which can stimulate the growth of abnormal breast cells. Regular physical activity, such as brisk walking for 30 minutes a day, helps regulate hormones, strengthen the immune system, and support overall breast health. Limiting alcohol consumption is another important precaution. Studies in both the UK and USA show a direct link between alcohol and increased breast cancer risk. Specialists recommend keeping intake minimal or avoiding it where possible. Similarly, avoiding smoking supports overall hormonal balance and reduces inflammation in the body. A balanced diet rich in fresh fruits, vegetables, whole grains, lean proteins, and healthy fats promotes long-term breast health. Foods rich in antioxidants, such as berries, leafy greens, nuts, and olive oil, may offer additional protective benefits. Hormonal awareness is also crucial. Women considering hormone replacement therapy, HRT, should do so under the guidance of a qualified doctor, as long-term use may increase breast cancer risk. Discussing benefits and risks with a specialist is essential. Regular screenings and mammograms remain one of the strongest preventative measures. Women aged 40 and above in the USA, and those invited for NHS breast screening in the UK, should attend routine checks. Monthly breast self-examinations also help detect early changes. Finally, understanding your family history and talking to your doctor about genetic testing, such as BRCA screening, can help you take personalized precautions. What are treatments and medicines for breast cancer? Breast cancer treatment depends on the type, stage, and overall health of the patient. According to Dr. Sarah Mitchell, a leading breast oncology specialist in the USA, a combination of medical interventions and lifestyle support provides the best outcomes. Early detection is critical, as it allows for treatments that are often more effective and less invasive. Surgery is commonly the first step in treating localized breast cancer. Depending on the tumor size and location, patients may undergo a lumpectomy, removal of the tumor only, or a mastectomy, removal of the entire breast. Post-surgical treatment often includes radiotherapy to eliminate any remaining cancer cells and reduce the risk of recurrence. Medications play a central role in both treatment and prevention of breast cancer progression. Hormone receptor-positive breast cancers are often treated with medications that block estrogen, such as Tamoxifen tablet, or aromatase inhibitors like Anastrozole, Letrozole, or exemestane. These medications are usually taken daily over several years, as prescribed by an oncologist. For HER2-positive cancers, targeted therapies like Trastuzumab, intravenous, and Pertuzumab are used to attack specific cancer cell receptors. Chemotherapy involves strong medications administered orally or intravenously, including Doxorubicin, cyclophosphamide, and Paclitaxel, which target rapidly dividing cancer cells. Chemotherapy may be used before surgery, neoadjuvant, to shrink tumors, or after surgery, adjuvant, to prevent recurrence. Supportive medications such as anti-nausea syrups or tablets, e.g. ondansetron, and pain management medicines are commonly prescribed alongside chemotherapy or surgery to improve patient comfort and quality of life. Specialists in the UK, including Dr. Emily Carter from London's Royal Marsden Hospital, emphasize the importance of individualized treatment plans. Each patient's therapy is tailored according to tumor type, stage, hormone receptor status, and overall health. At WA Health and Care, we highlight that self-medication is unsafe. Only qualified oncologists should prescribe these medications and determine the correct dosages. Regular follow-ups, adherence to prescribed medicines, and supportive care are essential to maximize recovery and minimize complications. With timely treatment and proper medical guidance, breast cancer is often manageable and survival rates are significantly improved. Thank you for watching WA Health and Care. Remember, early detection and proper treatment save lives. As Dr. Emily Carter highlights, routine screenings and medical guidance are essential. Like, share, and comment your thoughts, and stay informed to protect yourself and your loved ones from breast cancer.